Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Cria Padilla-Roleda from CDN Digital, together with the hospital at Maayo, and this is Maayong Adlaw Doc Season 3. In the last season of Maayong Adlaw Doc, we talked about the importance of taking good care of your skin, and we had a great conversation with Dr. Hester Limbueser and Dr. Armand Bertuan. We talked about basic skincare routine, how important wearing sunscreen is every day, and of course, how botulinum toxin or Botox can help you achieve younger-looking skin. Now we're back for more healthcare topics, this time concerning infectious diseases. But before we head over to our talk and introduce our guest for today, let's watch this video first about the hospital at Maayo General Consultation Suites. The General Consultation Suites comprise of various internal medicine and pediatric specialties in the fields of infectious diseases, psychiatry, and pulmonology, among others. These services provide patients with personalized treatment plans and collaborative care from a team of competent and hospitable physicians. It is an integral part of the hospital at Maayo's multi-specialty practice, which is a one-stop shop for all their clients' healthcare needs. Here in one of Cebu's bustling cities, Mandaue, the hospital at Maayo is designed to give you the care and services that you deserve. They prioritize you and your health, put your needs on top, and make sure that they give you a holistic medical experience. For today's episode, we will be talking about a disease that has actually affected our lives in the past 2 years. And we're talking about coronavirus or the COVID-19. Now let's learn more about this disease from our guest doctor today. Our guest for today is a graduate of Doctor of Medicine from the UP College of Medicine. His specialty is in internal medicine and has a subspecialty in infectious diseases, which he garnered from the Philippine General Hospital. He is a part-time medical specialist too at the Vicente Soto Memorial Medical Center, a faculty member at the Cebu Doctors University College of Medicine, research coordinator at the Chonghua Hospital Mandaue, and consultant for the Cebu City Emergency Operations Center and Project Balik Buhay. He is also the infection control chair and infectious disease practitioner in various hospitals in Cebu. He is an awardee of the Esteemed Individual of Cebu City, a young physician leader of the Inter-Academy Medical Panel, Asia 21 Young Leader of Asia Society, and one of the 10 outstanding students of the Philippines. Let us all welcome our guest for this episode, Dr. Brian Lim. Hello, Doc. How are you?
May buntag.
May buntag.
Salamat kayo sa pag-imbita.
I know, it's our honor good to have you here. No? Very popular, very active doctor, especially this time of pandemic. How has COVID changed your life so far?
Ay, karon nakapaway na taron, no? I think we're in a better place. But of course, for the past 2 years, it has been quite magitiguang gyud ko, no? Kita kusong uban, kay uban before the pandemic.
Lasala gyud sa pandemic ang uban.
Oo, kay kuan gyud, it has really changed a lot of our lives, no? But ako grateful kay Saggo, kay I was able to have the privilege to work with different sectors, no? And I think ako ang pagugma sa Sugbo mas napalalom, no? Kay murag daghan na tag mga kuan gyud, this is really home and worth fighting for.
On behalf of the entire Cebu City, thank you so much for the dedication, no? Because you were part of that group which created the protocols para sa city during height yun sa pandemic. So thank you very much.
Most welcome. Amping lang yun.
Maog yun, Doc. Sige, so let's start since we're going to talk about COVID lagi, no? What are the different updates now? No, I have this question, pandemic, no? Murag because of this COVID na himutang mga experts on pandemic, epidemic, mga terminologies. But there's this new term na pod, endemic. So unsa man what's the the status of COVID right now? Endemic na ni or pandemic gihapon?
Nindot kay na pangutana, no? And I think importante na ato gining masabtan ang pasabot aning endemic is kana ang sakit na nasa ato ang komunidad. No, it's here to stay, so to speak, no? Pareho aning tuberculosis, TB, na naman gina, no? Ang dengue, na naman gina.
So they're considered as endemic,
in a sense, endemic,
okay.
no? Nga ang kalay ani sa pandemic kay morning mga bag-o na mga sakitan na di pa ta kabaloon sa akong pag-manage.
Okay.
So katong paggawa sa COVID sa atuan ni spread all around the world. Wa gyud nasud na kabaloon sa akong pag-manage. Mo bitaw kung sige mibasa everyday, sige yung study kay sige mag-evolve, nag-evolve
Yes.
ang atong knowledge.
Yes.
Yang atong pong health system atong panahon na dili pagyudta kanang anad kung saong pag-manage ani COVID. Pero karon we are in a much better place. Ako nagsimile na gud taron, nakapahuway na ta na. Oo, nakaligo na tang tarong kay murag kanang kung ano ba kanang kabalo na ta unsa ang pag-manage sa COVID. Kabalo na ta unsa ang paglikay. Unya ang ato asang mga ospital, ato asang mga health system naa ra pud tay mga tambal. So mayong gani ka na ang sakit kay na endemic na pasabutan na dili lang na siya sa kung sa kadagan ng sakit kung rather than more importantly kung unsa ang ato ang health system, kung kaya na ba nato mo respond, no? But it doesn't mean na kung ang sakit endemic di nagiwa nagitay surges, mahitabo gyapon na nagyapon ni mga outbreaks. For example, sometimes na ate influenza outbreak, na ate hepatitis outbreak or unsa man, no? But it doesn't mean na di na to kaya na siya i-manage.
Okay. Speaking of kanang outbreak, Doc, I remember na there has been so many waves already. Pila na di na ko kadungdong.
Surges, one sa grupo naghihap.
Oo, no, do kadaghan na kaayo. Pero, di ba there will be, we can't say na wala naman yun. There's never gonna be any surges anymore na ang gihapon. So question is, are we prepared for that already? Is Cebu prepared for that? Is the world prepared for that?
Very good question, no? So we can really answer that. Ang ganito mga protocols would still remain.
Okay.
So, that being said, kung ako in a crowded area, magmask yapon ko o magmask yapon ko. Karon kay or in this place ya kanitong lugar para buyag nino kinig ventilation mo na isugod gyud ko diri kay even if indoor siya, the ventilation is really good. So mao gyapon, I think to adjust, we need to adjust also with the way we do things and do business, no? Na kanang kani mga alfresco nindot kay na kanang mga outdoors, no? Kay ang atuag yung understanding sa COVID karon kay kung naa kay properly ventilated, which means ang hangin nimo kay naagi flow, kay mas less ang chances na matakdan.
So are we trying to say, Doc, nga we shouldn't be afraid of COVID anymore?
I think life in itself, no? I mean, the risk of living is death, as it said, no? Ako, nituog ko na you should not hold your lives hostage out of fear, no? Ako, nituog ko na there is such a thing as kanabitang manage risk, no? You know that what the risks are and you manage it, no? So, ang ingana mo change yan ang ato ang life. We have to accept that, no? But it doesn't mean we should stop living, no? Karon malipay bitaw ko na mga tao uso na kay mga bagong parks. You go to the different municipalities, nindot kay mga tao.
They've developed their parks, no, for people to stay outside instead of.
Karon sa ato kong busay, daghan na mga
Al
outdoor
fresco na dinings.
Nya mga tao kay more patronize pud sila kana mga nindot na mga innovations. Nya kani pong mga building nato should really invest in improving the ventilation of their enclosed buildings, no?
So, kaning schools, let's talk about schools.
Yes.
With that, ngayong ka-improve the ventilation, are we ready for a face-to-face na classes? And
that's a good question. We cannot forever put our students na mag-Zoom lang forever. Ang kay ma-bright lang anang mga online, ang mga ginikanan kay usay sila na may mag-answer sa module. Tinutanay lang na ba? Luwi kayo mga ginikanan.
Yeah, but I don't do that.
Very good. Good. But ang point lang, Ani, I think it will be more harmful if our young people kay dili mag face-to-face. Can you imagine 10 to 20 years later, what sila skills, interpersonal skills niya, ang ilang pagkat-on kay dili kaayo in-depth kay na anay Zoom fatigue ang mga bata. Now, kanino mga eskwelahan, to answer your question kung ready na ba, it depends on the school. And I think, ang DepEd and even CHED, even diri sa Cebu City, no, kani ato ang Emergency Operation Center, grabe kina sila kananing sa pag-inspect sa mga eskwelahan. Proud kay ko na nila. Yung ang eskwelahan gani, di maayong ventilation, tudluan na nila on sa pag-improve. And sa ato lang, to our parents, once the school maayo lang ventilation, which means na ay mga bintana, abli ang pertahan, na di sa kay crowded ang mga tao. Sa sunyan, magmasa ang estudyante. Kuan siya kanang vaccinated, well, ang ato ang risk will be much less here. And I think the benefit of face-to-face overrules the risk.
Yeah, actually ako as a parent also, no, I really said yes to the school. They were doing surveys whether you allow your child to do face-to-face, and I really said yes.
Yeah.
I mean, I agree with you. We cannot hold them at home forever. They're never gonna learn as much as we did.
Yeah,
Kita.
tinuod.
Oo.
Kaya recess, lingaw ba kaya ang recess sa una?
Favorite subject na to.
Oo, di ba? Studio sa mga amigo, amiga.
Yeah. So I have a question. Basin medyo sensitive lang ni Gamay, no? Pero nag-wonder lang ko na lately bitaw, especially during the campaign period, murag the protocols have been disregarded. We allowed people to rally and be like really like, you know, side by side, elbow to elbow with each other. Anything.
Yes.
Like that.
Ako nakulbaan sa gigwa. Nakulbaan ko hala, maunsa na. But I think the reason why wala kita nag-surge in a dramatic proportion is because people were getting vaccinated. It was just right on time.
Okay.
Na kung wa siguro ta na bakunahan unya ng kampanya na mas nakulbaan gyud ko. But ako nalipay ko kay para buyag dinhi sa Sugbo kung ano ang mga tao naningkamot ba yaon bakuna, no? And ako san ma'am, although this is just a theory, no, di pa man gid siya well established, na kung ang mga bakuna magudahilahig pud og para napo ni advantage, no, napo ni advantage kay diversity is always good. And ang mga campaign stints pod usually they happen outdoors. And as we know, kung outdoors is has less risk than indoors. But I think the bottom line yung game changer gyud nato ani bakuna gyud. Bakuna gyud.
Would you have any idea, Doc, kung how many % of Cebuanos have been vaccinated?
Oh, dili ko updated sa current data, but in some cities they have reached around 80 to 90%
Wow, that's
also,
amazing.
no? And I think now we have enough, and that's I think the good thing, no? We have enough vaccines, and we are now pushing for of course boosters katupang mga mo qualify for the first booster, no? Nya karon ongoing gyapon ang atong vaccination, and then special hi no sa ato ang mga colleagues who have the grabe ang suporta o volunteerism sa pagpabakuna.
Speaking of vaccines, we have vaccine 1, vaccine 2, booster 1, booster 2, and then we're hearing another booster, a third booster. Is that true?
So kaning para ato nang sabta ni booster, ang booster mo na siya nag-review ka sa exam. So ibakunahan ka, so imong immune system nag-study unsa ang pagpatay sa COVID. Yeah, as time goes on, kamo ba ita na kanay mong study makalimtan ba na? So muna na ati booster, kaya booster muna imong review o pag-review be kanang pero karon nag-review ka, mas dali na lang na makat-on ka kanang second reading naman na nimo ang booster, more review na lang na. So muna ang science sa booster. So ang first booster is really indicated, no? Kay naagi science shows talaga na after sa imuhang primary nimo na bakuna, yan ang first booster ka after at least 4 months, pag booster nimo mo jump up yun ang immunity. Nindot kay siya. So kaning mga tiguang, elderly na mga comorbidities, health workers, nindot gyud kaay na atay booster na first booster. Ang second booster, ang evidence dili pa kay siya strong, no? But we offer it kay ang kaning magong especially si elderly o kaning mga na immunocompromised, kaning ni-take og steroids, na mga autoimmune, nag-take og chemotherapy, kay mga na HIV, na ang immune system nila kay us-us, nano ato man nag-recommend kay kaning mga subgroup of population dili man gud garantisado na ang ilang bakuna sa una ni mount og immune response kay to begin with weak man to ilang immune system. So mo ni ang mga recommendation nato. Pero wala pa tay third, murag I don't know if naapat. I think that's the thing with science. Kinahanglan we must adapt, no? Kanang naibag-ong science, kinahanglan di kita murag di gid ko mao gini ako what if sayop diig ka. And that's what the pandemic taught us. Now we have to adapt as the science adapts.
Kasi maulagi kay basi ko na po third and then eventually na pod. So people ask, is this ever going to stop?
Tinuod na, no? So that's a good question. That's how the influenza, the flu pandemic started and ended in a sense, no? Ang influenza, namuti pandemic before in the early 1900s, millions have died. But the vaccine came out, and then we learned through a lot of computer modeling na every year mo change gyud ang proportion and types of kaning mga napoy variant ng influenza. So that's why we do it every year to immunize ourselves.
Bitaw, no?
So who knows? We don't know yet. To be honest, we don't know yet, but it may happen. But again, karon murag abangan ang susunod na kabanata mo na, no? Unya na taan ang magunahuna.
Bitaw, no, kasi influenza, Doc, every start sa kanang murag rainy season,
Yes.
kinahanglan mo gito magpa-flu
season,
shot.
matag na ta, even before the flu season occurs.
So is there a possibility that COVID will eventually end up like influenza?
Yes, there is a possibility, no? But of course, we don't know, honestly, because magpupagid siya to think na ang influenza 100 years na, ang TB thousands of years na.
Bitaw, bago
So,
pagid
bago
siya.
pa siya, baby pa siya in a sense.
Right. So that means now we don't know whether there's going to be surges pa in the coming months or years ba. But just in case, Doc, just in case na as an individual kami,
Correct.
how are we supposed to prepare for that?
Nindot kay pangutana. Sa una, kung kita mahilantan, stress sa mga staff kanina, kung mahilantan, kung ano tanong, fixed oil, higop sa baw, no? Murag, okay na ka. Karon, lain na atong perspective karon. Kay karon, kung hilantan tamaluya, nagkanang tabunahunaon. Pwede dengue season na. So, kinanga careful. Pwede influenza, flu. Pwede po other viral illnesses. Pwede po COVID. So, part na gina siya sa ato ang hinahunahon.
Bitaw.
Nya, ang kakuwalan ani, kung mag-testing magudta, di na kita mahadlok. Kasi una, kung man ta, mahadlok tayo,
Isolate yun ta.
Kaya di na, the purpose of testing, kaya para makahibaw ka, kaya para matambalan, na may tambal. No, ang COVID sa una, murag, sa tinud-anay lang, katulad sugod pa lang, ang tambal gid panghaji. Katuwa pagitay tambal.
Kaluoy
At tinud-anay, kung naay mo tawag na mo, katong start pa lang na, patay kalit na, we were testing some drugs but we were not yet sure. Ang una guna mo reflex kay mangurus. Kay, it may or may not work.
Yes.
No? But now, daghan na tagtambal.
Mao pa.
So, especially katong naay mga comorbidities, katong mga elderly, kinahanglan na mag-test kay sila maging mo benefit sa tambal.
And again, we go back to the fact na probably this is all because we've been vaccinated, no?
Yes.
The symptoms have improved,
Din na.
no?
Hindi ko kalimot, no? Na ako'y do ka pasyente sa una, usa 80 plus years old, katong Delta, ha? Nakato 30 plus years old. Ang na-intubate na ko ang katong 30 plus, kay unvaccinated, no? Nya katong 80 plus, nabakunado, ubusin on lang for a couple of days. Nalingaw kay ko ato ni manang kay na-pressure to siya sa mga amiga kay di man makigmadyo yung mga amiga
Kung di siya vaccinated.
di man siya ka-apri sa madyo sa mga amiga kung di siya magpabakuna. So murag si mapapakuna
Vaksina
na
lang
lang
ko para tamanjong ko.
O lingaw lagay. So kato murag ako gatugbong itong glaring example na halano.
Yes.
Halano niya 80 plus na buto niya na pa diabetes, hypertension. Halano. Pila ra ka adlaw ubog.
So this is now an official statement that when you get vaccine, you don't turn to be a zombie.
Oh, you don't. Dugay na na, oy. Ginoo ko, no?
Ano mang good to know?
Nagi na mga, nagkakibot-bot sa una, no?
Oh my goodness.
Lisod bitaw, i-communicate, no? Kamisad mo
It's difficult to make people understand what they're not familiar with bitaw.
Kasabot sa ta, kay sometimes, kana manggong mga tao na tungod sa fear, no? They listen to sa mga marites, no? Pero di na mo judge, pero ato lagi na silang explain na. No? Ana lagi na.
Sige, Doc. Thank you. Now, I asked earlier, private citizens, how do we prepare? You answer that. How about you? You people, the professionals rather, who are dealing with this, how do you prepare in case lang yun na ano po'y surge nga mo abot?
Oo. So, kung in case na naan na po'y surge mo abot, I think Cebu now is in a better place because our hospital, sa unang magot ang mga hospital nato, wagi hospital na ready for a pandemic anywhere in the world.
So, systems in place na yun right now.
Yeah, we have to change the protocol, we have to restructure, literally, we need to redesign. Ang mga health workers sa una, di ba taanad magmasok ka ng huot yung kayo. So, murag, dagkan kay mga nasipyat pero karon anad na kayo, bastard na kayo, no? Karon bitaw ko na COVID, mo sa una panic mode, karon okay, ato lang isundin na. Nga naman ta, murag anad na ta. So I think in the long term, COVID should be taught in medical schools and other health-related schools. We need to update our curriculum. Itudlo gina ang pandemic response sa mga health students, no? So kami murag better prepared na ta.
That's great. That's
Daghan na
good
po
to know,
TB,
good.
daghan ng tambal, nag-stock na ang ato ang both public and private, no?
That's really great to know, Doc. Just in case na ay new variant na po nga moabot.
Good question.
Unsaon man na nato?
So kung na new variant, the first day is not to panic, no? Not to feel depressed. Ala, unsa naman
Gani.
uban mabayolente na. So bago na lang ako ng variant ay kapay kay di ta magpanic, no? First is we need to see first kung kanina variant kay variant of concern ba ni siya or dili. Pasabot ang variant of concern, pasabot ana dali makatakod or more deadly, no? Kinahanglan ato ginang tukion, di lang ta mo tanang variant sa UK. Ani maguning variant ako na explain. Ang virus mo na chismis. Di ba kung ang chismis imo ipasa mag-change naman na naninidagdag bawas, hudihan sa mo sa imuhang uyab, pag-abusin mong inahan, nagminyo na mo, no? So, kay each time the virus is transmitted, naagi na siya changes. And that's how variants are transformed. So, the more it is transferred, ang viruses, the more variants will spread.
No?
So, storya, pila man naka-variant na adi na do, di ko kibaw, I think there are a lot. Okay, mo change magina siya. But not all variants are dangerous or are more dangerous. So, ato gina siya tukion sa, no? Before tamo
Bitaw. Whether it's really like deadly
yeah,
ba or
deadly
di.
ba or infectious ba?
Speaking of which, because other people, some people are considered to be OA na gyud when it comes to protecting themselves. But is there really such a thing as OA when it comes to protecting yourself?
I think we need to respect the individual choice of a person. No? Each person has their own sense of how averse they are to the risk. No? Kaya na ay pasyente na chill ra, nasa uban na ato ginang respetuon kay I think kalisod aning pandemic it has affected our mental health also. No, nakinahanglan lahi-lahi gyud ta og rate in terms of adjusting. No, na sabtan ginato na siya.
Okay. Others ba, like ikaw, you're just following the protocols, pero others, they would insist, bilang duol gid nimo, di pag gid sila mag-mask.
Mao lagi.
What do we tell them?
Wing ana na lang, choose your friends na lang according to your to how well you
Okay lang ang friends, Doc, but like when you're in a public place, bitaw,
you're right. In the public place,
groceries,
oh
my
you're right.
goodness.
When you're there, you just have to wear your mask, tight-fitted mask, no? And then pag uli nimo kaligo. That's it. No?
Kana ra gyud, no?
Kay di naman ginato makontrol ang ubang tao.
I remember something regarding bubalik sa ako, Doc, ha, sa vaccines na to. Okay. I remembered na I got my booster and it was nearing expiry na. Okay pa ba na siya?
Okay pa na. Okay pa
How
na.
long pa na siya pwede?
Ana, lisod na siya i-estimate, but as long as wa pa na na-expire,
wala
it's still
pa.
good. It's still good.
So far, we still have a lot of vaccines
o
supply.
Daghan pa,
Nga
please,
dili expired.
Napa. Oo.
Kaya I think some people, I've heard from some friends po nga di sila magpa-booster kaya expired na kuno ang mga booster. What do you have to say about that, Doc?
Kaning ato ang for Cebu, no? Ako, I know this for a fact, no? Kay active man ta sa kaning ato vaccination program, and our vaccination leaders here in Cebu are very strict, no? So we do report kung naa ganing mga maganing bakuna na good for how many people man na usahay kaning last dose gamay na lang kuwan na 0.0 ano na lang
Dili
ilabay
hatag.
ako nang ilabay, no? Kay wa man ta nag importante ana atong mahatag sakto yun, ilabay na siya,
Okay.
no? I-report na siya na as waste, allowed man ta.
So can we assure our viewers, the Cebuanos, na dili expired atong
dili
gihatag?
expired. Oh yes, no. Of course, no, we cannot control everything that goes down the way, but of course
Yes.
in the program, we do not release vaccines that are expired. Dili gina, no. And our health workers who are injecting are also reminded time and again, and sakto sa no, na kung pag ana gani nimo, oops, nasipyat na inabili na nituo, ayon na ihatag. Okay ra na. Dili kay kanindot ana is dili man sila kasabaan, holo, nagsayang, no. Kay kung imo magong kasabaan, baka din na mo report. So kana, walay ka pala ka, kung mahitabo man na, it's okay. Labay na to, aton lang i-account na wala na use. Ano lang, that's it. No? So, through the many months of vaccination, we have vaccinated more veterano na sila. May nakaayo. So, kuanta, no, they are safe and effective, no?
And actually, Doc, murag daghan-daghan pag yun in reality, tinuod, daghan pag yun og vaccines because when I got my booster shot, giingnan ko sa the one who gave me the shot na please invite your friends and your other family members to get their booster kay maulagi daghan pa daw kuno.
But of course, kung ano ni siya, wala ni siya pugsanay, of course, no? Kay
Maulagi invite daw.
okay lang, go ahead, no? Sige.
How about future pandemics? Are we looking at something else?
Wait, that's a good question, no? That's a very smart question. Kay in this world, lahi na ang kalibutan, no? Katong sa una kita, ano na, karon lahi na. We are now entering in a world na pandemics are a reality. And many reasons are this, no? Is when we encroach on nature, and nature sort of fights back, no? In a sense na kung naay mga kagaw na normally sa mga mananap para na sila, kaya tungod ato gi-invade ilang home, deforestation, or kanang livestock na to na ang mga baboy o kanang mga manok kay huot kayo sila. Kung naay mga sakit tina, pwede na sila mo cross over, mo spill over sa ato ang tao. Nya, so ato pasabot ani ang pandemic, there will be future pandemics. Na dili ginagina nato na siya i-deny. No, actually years before amo na nang gi-studyuhan na ay may tabo wala ko na-expect na it will be this, no? Pero ang ato ang pasabot lang ani, that means when we do our planning, kinahanglan part doon na sa plano. Di ba? So kung mo design kag eskwelahan o balay o building, imo na nang hunahunaon na ang ventilation nindot yun ha, na ako'y exhaust yun ha. Di ba niya? Kaning protocol na to sa handwashing, sa paglimpyo, sa hygiene, kabalo na ta. Kaya kung na may pandemic, we know how to prevent. That's just how it is. No?
This monkeypox, Doc,
Oh,
that we hear, can we know a little bit
Sure,
about
a little bit, no? Of course, no, we will talk about more extensively some other time. But ang kaning monkeypox, naman na sa una na anay smallpox o monkeypox na sa una. Kaning smallpox, mauning ka ng infectious gyud kay ni. Mao sa una na deadly, dali kay mo spread. Mao to nag-mass global vaccination. Unya na eradicate na gyud ang smallpox.
Yes.
So if you lived, if you're older than 1978, nabakunahan na kaana sa una. Kami wa nami kaana kasuway. Anya kakwasan ato kung bakunado na magug ka sa monkeypox, there's a huge chance
or smallpox.
Nabakunahan na ka og smallpox. There's a huge chance na protected na pud ka sa monkeypox, no? But karon man god wala naman tayo atong bakuna. So muna siguro nilusot-lusot na siya. Pero di kay kumapulbaan ana niya as of now, kay dili man siya as the same as COVID na paspas kay spread, no? It's really close contact, no? Droplet pero close contact na gunitan ana gyud, no? So usa man pag-prevent, mo ra gyapon mag-wash your hands, no? Mag-mask gyapon ka.
So you mean to say, Doc, ang monkeypox has been there also for a very long time?
It has been there already. Dilusot lang yun siya now. But of course, we are monitoring this, no? Di kita mo sulti og ka ng finality. Kaya it's still evolving. We are studying it. But that's how reality is. We need to continuously study. Kay you are dealing manggod with an organism na not under your control.
Bitaw. So are we seeing monkeypox as something na eventually would turn into a global threat again?
We don't know yet.
Okay.
Yeah,
So we don't have to be really scared now, like
no.
Or would it be unfounded nga fear kung mahadlok na ta karon?
Ako karon kasi I think, that's a good question, and I will answer it, no? Kay kami magyud ang front line na ningon sila, Brian, di ka mahadlok na sa clinic or sa ER na kay makita ko na dili ko mahadlok in a sense because I know how to prevent. I know how to protect myself, no? I know how it's transmitted, so it's still droplet sa mask. Di ko mugunit sa kuang mata, ilong, iba-ba kung ako nag-wash akong hands. Mag-mask gihapon ko kung ako yung pasyente na hilantanon niya na air nang pula-pula kay na air rash, mag-mask ko, niya maggunit, mag-alcohol ko pagkuman, okay ko. Ano siya. So, kung ano nino, I mean, i-balance lang yun na nato. Kaya ako, di sa puginahan na, what a way to live your life. I mean, there's been a lot of threats already in the past. na karon siguro nalimpyo-limpyo na ta murag hadlok na, pero tinud-an ni daghan bitaw laing sakit, daghan
Bitaw.
yun, no? Pero doesn't mean that we don't live our lives.
Bitaw. I think also, Doc, other than us being kanang careful, no, being clean, I think we also have to be responsible in a sense na if we feel sick,
Sakto
let's
na.
just please stay at home.
Yeah,
Okay? Let's
sakto
not
na.
insist on having fun, going out and spreading
Correct.
whatever disease we have.
Correct. And then kanina sa karon nalipay sad ko kay kanito mga chambers of commerce during the pandemic, on board man na sila, no? Ang atuwag yung mga companies, naagid na yung gitawag na kanang sa una, you need to discourage absenteeism, no? Karon, you need to discourage presenteeism. Sabot na, una kang ipamati, ayaw na bitakdi.
bitaw.
Kay, mas, it will be more harmful. Kaya kung itakdan na nimo imong tanang staff,
Yes.
sarado inyong office.
correct.
So, managpahuway lang niya. Kaninot karon kay I think mas comfortable na tag-hybrid, no? Sa una mo miski mo nag-type ka niya, wala kay meeting, atong gikas
Kinanglan,
office,
pag sanay gid ba? Nagid pa nga na.
Karon mas kaninot karon kay komportable na ta ba?
Mas productive ganito
Mas
nga,
productive,
right?
correct. Kay ubang we acknowledge some people are more productive at night.
Yes.
Ano.
So before we end our show, Doc, please, what can you say to our viewers regarding mauna COVID-19 na to? How do they take care of themselves?
Okay. So, salamat kayo sa pag-imbita na sa tuong mga viewers. Ang COVID-19, we are in a better place now, no? Para buyag lang yun, lahi na kita karon kumpara 2 years ago, no? Sa una, kanang wa pa kita kabalod sa pagtambal, naglisod pa kita o pag-implement sa tuong mga protocols, kunya kato daghan pa kita mga fear, kay di pa mo kita kabalo. Karon, mas nindot na karon kay ato ang health system mas naka-adjust natay mga tambal niya daghan po tag mga bakuna, no? So karon naa na kita, this is now time to rebuild our lives, no? Let's enter the new norm with optimism, with hope, and of course kanang di sa ta magpataka-taka lang, no? So we need to also continue, of course, wearing our mask and of course washing our hands and observing proper hygiene and staying healthy. Importante yun kayo. But of course, importante, let us continue and move forward, no? Importante yun na to move forward.
Thank you so much, Dr. Lim. You know, we appreciate this so much. Thank you for this very informative na episode, and we hope to have you here again next time. Thank you, Doc.
Thank you. Sige.
And that's it for our first episode for Maayong Adlaw, Doc Season 3. Thank you very much for joining us today. Please share this episode to your friends and family so they may also learn from our discussion for today. And of course, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience in Cebu at the hospital at Maayo. This has been Priya Padilla-Roleda from CDN Digital. And of course, if you want to know more about the hospital at Maayo, please check out their Facebook page at the hospital at Maayo. And you may also check out their website at www.thehospitalatmaayo.com, or better yet, call these numbers below. Thank you and see you next time.